indicated on our website. We've had an undisclosed number come in just this morning. I don't have the actual number for you, but I'd be reporting on that tomorrow. If you look at our 9 new cases above the 99 that were on the chart yesterday, I did speak to 5 of them in Bradford Valley long-term care facility, 4 being residents and 1 being a staff member. Also among the new cases is 1 individual who's hospitalized, listed as a male in his 30s in Bradford, West Gwillimbury. We have no cases that are related to travel among the new cases. So the cases are either due to community acquisition or being part of a facility outbreak. And all of the cases are in municipalities within Simcoe County, none are within Muskoka. If you look at our information on our website, it indicates that we've had 40 of our cases recovered, 14 hospitalized, 5 passed away out of a total of 108. And as always, the middle years make the majority of the cases, 50 of our cases between the ages of 35 and 64, 38, 65 and above, and the rest younger ages. So 40 of our cases have recovered. 34 of them are in self-isolation. 14 have been associated with facilities, long-term care facilities. We have 14 that are hospitalized, 5 deceased, and 1 that left our district, went out of country to the United Kingdom. Of our cases, 40 are related to travel, 22 are due to close contact with a known case, 14 are part of a long-term care facility outbreak. 29 have been community acquired and 3 are under investigation. And then we have a listing of the number of cases per lower tier municipality. If you look at our epidemiological curve and you discount the preceding 2 weeks as we're looking at the date of onset of the cases, knowing that anything within the last 2 weeks would be incomplete at this point, people would be developing symptoms at that point and then seeking medical attention and then being tested. So there's a lag and you have to wait a couple of weeks out before you can be sure of what's going on in that time. But period leading up to then, you definitely have an upward swing in cases. And so with the combination of community-acquired cases and an upward swing in cases, I emphasize once again the importance of people taking their precautions with the physical distancing, really thinking twice about whether or not you need to be going out, keeping a 2-meter distance from other people, avoiding crowds, hand washing frequently. If you do develop symptoms, you need to be self-isolating for a 14-day period to avoid transmitting to other people, erring on the side of caution, and seeking medical attention if you develop severe symptoms such as shortness of breath, using the emergency department in those instances. If you're a healthcare worker, it could be a case, or working in a long-term care facility or in a long-term care facility, or living in a remote community or in a First Nations community, then indeed you should be tested for COVID-19, going to an assessment center for that. My understanding actually is that at this time there's greater capacity now for testing, that the assessment centers have the ability to take more people to test. The laboratories are able to take more testing, and there's consideration being made about opening up the criteria for who should be tested. And so we've positioned to our facilities that if they have the capacity to do testing of other individuals, they should do so. I certainly see it as a benefit for people with symptoms to know with the testing that they're positive. I think it would help with compliance for the self-isolation, and we do know from research of countries that have been able to do a lot of testing that it seems to have made a big difference for them for flattening the curve and reducing ultimately mortality associated with this, and reducing the spread and affecting other vulnerable individuals. Certainly people above the age 70, the Chief Medical Officer of Health, David Williams, has recommended that they remain in self-isolation, that they're more vulnerable, more likely to develop severe manifestation, hospitalization, and death. And so they should be very, very cautious about going out and making use of other people to assist, meeting their needs, getting their groceries and their medications, and those people doing that in a way that respects the 2-meter limit when they're helping them out. Just going to go through a few detailed points with regards to our 2 COVID-19 outbreaks. We very fortunately remain with only a single case at Spencer House, despite the follow-up investigations that have been done and the tests that have been done to date. We've had many other negative tests come back on staff, and we do have some results that are pending for some staff and some residents, but to date we've been fortunate that we haven't had any other tests come back positive apart from the initial test that was positive in a staff member. With regards to Bradford Valley Long-Term Care Facility, we have had in we had in total the 2 staff results that have come back positive, and the 4 residents that I beg your pardon, 14 residents that have tested positive in total, and 2 staff members. There have been many other tests done. Some of them are pending, some of them are negative. So we are monitoring that situation very closely, and certainly they have in place all the precautions necessary, including universal use of masks by the staff, and very intensive surveillance of staff and residents to detect possible cases and refer for further testing. So turning to my notes of matters to be discussed, we've had some questions with regards to properties and condominiums, multi-unit dwellings. We have a new section on our website under COVID, under landlords, property managers, and condominiums. It includes comprehensive recommendations about how those premises can be managed to reduce risk. They include closing the gathering areas, increased sanitation for common spaces, a reminder to the units to limit their guests and to practice the physical distancing themselves. And certainly we would recommend that people have a look at that under partners, and can also be found on our website under partners and essential workplaces. We've had a question about the number of tests that have been done locally, and what I would say about that is that because the province has created this method now with posting on a website people's laboratory results, and people can get them directly themselves, they're no longer going to be providing us as a health unit with the negative results, and therefore we wouldn't be in a position to be able to contact everybody with their negative results. They'd have to look at the website, or they have the opportunity to look at the website and get that information in a very timely way themselves. So from this point forward, we're not going to know about the negatives. We won't know how many more negatives there are. I would say up until this point, we've had a total of 2,112 negative test results come back. But that will not be useful information going into the future, and even that figure is not complete because as hospital laboratories came online for doing testing, many of them didn't provide negative tests for us, or at least at the beginning they didn't. So there's a point here about the self-serve test results available on the website. I think that that's a very good resource for people. I think that it's very helpful for people to get timely results, whether positive or negative. Certainly, for those who end up with a positive result, it reinforces the need to be continuing with their self-isolation to avoid transmission to others for the full 14 days of isolation. And their isolation needs to be strict. You can't leave your property. It might be tempting if you're feeling better to go out and simply avoid people. You must not do that. You must stay home on your property to avoid transmission to others, and exercise caution about being in direct contact with other household members who are well. There was a question about the health unit doing on-site visits for facilities that have an outbreak, such as the two that have COVID outbreaks, and I'd indicated before that generally we do not go on site, and just want to confirm that we generally do not go on site. We manage it remotely through telephone contact with the premises. The exception that we would make is if an outbreak is continuing excessively long, and if we get any sense that there's a lack of compliance or anything new that needs to be done that would need our presence on site to do. And this would, I think, at this point in time be particularly appropriate because of the physical distancing that we need to be doing, and that means also us as health unit employees not going onto premises where, unless it's absolutely essential that we do so. There's a question here about is there anything further that can be done to prevent this virus from being transmitted in nursing homes? For example, can you do more testing of employees even when they have no symptoms? So what is happening now for homes that aren't in outbreak, as well as those that are out in not an outbreak, is that there's no visitation required. And the staff are screened. Anybody that comes on the premises are screened, and those that remain on the premises are screened twice daily, and all the residents are screened as well. And we are also recommending that staff wear masks universally in healthcare settings, including in long-term care facilities, while they're on the premises, while they're working. That they do so in a way that conserves masks, because there is a shortage of masks, but we know that transmission can happen without symptoms. And the vulnerability of long-term care facilities is people coming in, and at this point in time, it's essentially staff that are coming in, so we have to take all these precautions with staff. I have had some discussion with managers and clinicians that work in some of these facilities, and they tell me that staff are acutely aware of the importance of this, very aware of the importance of this, of exercising all that's required of due diligence for the physical distancing in their lives to avoid becoming a case themselves and avoid potentially bringing it into the facility, that they are aware that transmission without symptoms is possible, so they need to be all the more cautious, and that they're acutely aware of just how important it is to avoid this being brought into their facilities. So the question about testing of employees even if they have no symptoms, province has maintained the position that it is not helpful to test people without symptoms, that you can have a false negative test when in fact they're about to emerge as a case, so that means false reassurance. And therefore, the recommendation is that we shouldn't be testing asymptomatic people or people without symptoms, and that would include in long-term care facilities, that would include the residents and the staff. I am aware that there's concern about that from some of the operators, some of the staff, or many of the staff would much prefer there be screening of asymptomatic individuals as an added precaution. And I would say that to date, we don't have the evidence to support that approach. Certainly, new residents coming into the facilities need to be put in isolation for a 14-day period, the incubation period for this infection, before they can then be brought out and associate with other staff or residents as an added precaution. And I'm aware, as I said, that there's somewhat of a desire for this kind of screening of asymptomatic people, but to date it's not been supported as a helpful practice. So there was a question here about testing and the lack of backlog of testing, but also the perception that there's a reduced amount of testing that's now happening. A report that both Midland and Aurelia's assessment centers are actually reducing their hours because of reduced testing. And so there's a question about the trend in Simcoe, Muskoka overall. And are we noticing fewer tests being done or processed? And if so, why are those test numbers down? And would it not be better to increase testing now that there is more capacity to process results? So this has actually just come in shortly before today's session. And I have to say that this is new information for me, and we will look into this to see how accurate this perception is. I do know for sure that there's no backlog anymore and that capacity is up, and that the province is looking at increasing the criteria for testing, making it more available for more people. Certainly I support that. We know that the countries that have done better with this have had very high saturation of testing, availability of testing, number of tests, proportion of population tested, and that helps support people going into isolation, being identified by us and followed up by public health to ensure that they're in isolation, following up with their contacts, and where appropriate, putting them into isolation. So I'm all for liberalized testing, and look forward to the province landing on that decision about broadening out the criteria for testing. And we have communicated to our assessment centers that if they have the ability to do more testing beyond just the priority groups, that we would support that. So another question, the ability of people to go in and check their results on the new government website, and the link and the benefit of that from the health unit point of view. And as I already indicated, I think it's very helpful for people to be able to get the results right away, get them themselves, act on them themselves. Just a bit of a warning, if you're able to get them really quickly, you'll get them possibly before we can phone you from public health for follow-up. So don't be surprised if you're really quick about checking it out that you got to it. We're getting to it right away, but it takes us time to actually then phone you. There might be a bit of a lag about that. If you turn out to be a positive case, we will phone you, and it might be that you get it from the website before you actually get a call from us. You should be in isolation if you are awaiting a test result, and if it's positive, you need to stay in isolation. There's another question here about a report of a New York zoo animal, a tiger I believe, that tested positive for COVID-19. Is there any concern that domestic pets or other animals may be spreading the disease? And our guidance to date from CDC Atlanta and Health Canada is that although there have been rare instances documented of household pets, dogs, cats, very rare, but nevertheless documented, contracting COVID-19 from contact with a person, there's no evidence of then people getting COVID-19 from pets. So to date, we don't have evidence that this is a significant issue, and therefore I wouldn't be advising or providing any particular advice about pets versus COVID-19. Certainly, the question of animal health is beyond my scope of practice. I wouldn't be able to advise on that regardless, but certainly what's within my scope is the potential for people to get infections from animals, and in this case, we don't have good evidence that that's happening. So at this point, sorry, one final check, make sure I've covered everything. At this point, I'd be happy to take any questions.
Okay, thank you. We'll start with Adrian.
No, I'm okay today, thanks.
Thank you, Adrian. Andrew?
Hi, Dr. Gardner. How are you doing today?
I'm doing well. How are you?
Good, good. In terms of the precautionary measures being put in place at long-term care homes, has there been any dialogue between the health units across the province and the province in terms of ensuring that everyone's kind of learning from one another and have the best practices in place?
There's been some communication. Certainly, I've communicated to the Chief Medical Officer of Health our position in Simcoe, Muskoka, and for that matter, the position of all the medical officers of health in central Ontario, that universal masking needs to be done in healthcare settings and in particular at long-term care facilities as a precaution because of asymptomatic transmission. Indeed, there's been communication, and we need to continue to communicate about this because it's such a very serious situation. These are highly vulnerable people. We've seen devastating outbreaks with high mortality and many staff also becoming ill. Very, 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 very important topic. So we need to continue to monitor it and work together on it. And to me, one of the key things right now is the idea of universal masking being in place.
Follow-up, Andrew?
Just in terms of the hospitalization in Bradford, case number 108 that was put on the site today,
Yes.
What hospital is that person at?
South Lake Regional Health Center.
Okay, thanks.
Thank you. We'll go on to Natasha.
Hi, yeah, that was my question as well. So do we know the status that he's in? Is he in ICU or?
I don't actually have that information.
Okay, thanks.
Anything else, Natasha?
At Bradford Valley, do you know if all the staff have been tested or just only people who are experiencing the symptoms?
So we recommend that all with symptoms be tested, and we've had many tested, many staff tested. What's implied with that is that they would have symptoms, and so they'd be considered as possible cases. But we do know that some people come forward and arrange to be tested even if they don't have symptoms. So I cannot say that all of them have been tested, and I can say that what we advise is that it be those with symptoms be tested.
Okay, thank you.
Thank you. Mandy?
Hi, Dr. Gardner. One of my questions was already asked, but my second one is in regards to yesterday. You had said 2 patients had been hospitalized but have now been released and are recovering.
Mm-hmm.
I know the one patient was a Barrie gentleman in his 40s. What patient number was the other person?
So generally we don't, I mean, I don't have that right on me for one, but I'm also very cautious about releasing too much detailed information on individuals. I always want to be careful about the potential for them to be identified, but actually I don't know. I don't have that in front of me. At this point, when I look at the spreadsheet of hospitalized cases, we have 3 now that are recovered.
That's great.
Okay.
Okay, thank you. James?
Yes, hi there. Yep, hi. Dr. Gardner, so yesterday in Barrie, that was the first, I guess, official community-acquired case of COVID-19. I know that you've already been speaking to the fact that it is already in the community spread, but should there be, a sort of heightened sense of concern in Gravenhurst over there being a higher amount of community spread there?
I think it's much more helpful to assume that it's everywhere, because you don't want to wait until you have documented cases for sure in every community to take precautions everywhere. Everybody everywhere now needs to take these precautions of the physical distancing, and therefore I wouldn't want people to conclude that this is only a problem in Gravenhurst and not the case elsewhere in Muskoka. I think it's much safer for everybody in Muskoka to assume that they have community transmission and they need to be doing what's needed to deal with community transmission, namely the social distancing, the physical distancing.
Okay, and you were talking about the need for expanded testing. Is that something you are going to push for, to have more availability? Because I know a lot of people, feel that they're just not being able to be tested and they think they might have COVID-19.
Indeed, I have communicated that view to the Chief Medical Officer of Health, and also to those who are doing a guidance document about laboratory practices and testing, and will seek and take advantage of other opportunities to advocate for that.
Thank you.
You're welcome.
Right? And Nathan?
Good afternoon. Dr. Gardner, I just wanted to ask you a bit more about that online portal that is available for people to check their assessment status. Mm-hmm. And you were saying earlier that when people go and get testing, they should be self-isolating anyway, right?
Yes, they should be seeking testing if they're symptomatic. If they're symptomatic, they should be self-isolating.
And you said that sometimes if they're really diligent, they may see the results before you give them a call. When you give them a call, what exactly do you say to them?
We tell them that they have a positive test result, and then we take a history to determine how they might have acquired it, what their symptoms are, what their risk factors are, their age, etc., where they live, where they got tested, who their contacts are, the timeline, when do their symptoms begin, their work environment, all kinds of things related to the situation to allow us to reduce the risks for others and for them as well.
And sorry, just a quick follow-up. When you look that stuff up, isn't that usually covered in the original assessment when they go to the assessment center, when they ask about the history?
So that probably is. We would have limited access to that history taken at that location, and so we take our own information.
Gotcha. Thank you.
All right, Doug?
Well, there's been other jurisdictions that have used marijuana growers in their lab facilities for testing. Is that something you've considered with Muskoka Grown? They've got a fairly robust lab and cuts down on sample traveling time and things like that.
Let me see if I understand you. You're suggesting that Muskoka, this operation that grows cannabis in Muskoka, has a laboratory and would be able to do this kind of testing? Is that what you're suggesting?
Yeah, apparently all marijuana growers have pretty robust labs available, and some have put forward capacity for testing.
Well, so far it's been hospital laboratories that have participated in this, and it's been very much a process driven by the province, by Public Health Ontario, and hospitals to expand their capacity and recruit other laboratories. I've not directly participated in that process myself, and I actually don't have inside information that could speak to your question.
Thinking outside the box. Thank you.
Okay.
Thank you. Erica?
Yes, hi. My question is related to the current outbreak listed on your site. There are 2 long-term care units listed there where the type of outbreak is confirmed COVID-19. There are 3 that are pending: Bayhaven, Collingwood, Creden Valley, Creemore, and Muskoka Shores in Gravenhurst. Does that mean that they could possibly be COVID-19? How and when do we find out about that?
So it is possible, certainly through the winter and at this time of year, we have numerous respiratory outbreaks in long-term care facilities. And the fact that you have these other facilities with outbreak doesn't at all necessarily mean it's COVID, but it could be, which is I think why we've got that listed, why we're investigating those outbreaks, why we're following them closely, and why they all have the same control measures put in place that I've already spoken to for the two that are confirmed. Oh, your question would also be, when would we know? Test results are sent. We get results back typically within a day. If we get negative results, that doesn't necessarily mean that we're out of the woods with them. We would continue to be following them closely. Most of the time we actually don't get a positive result back identifying the organism. And so until you know for sure what you're dealing with, you're still on the lookout for COVID, or even if you do get another organism like influenza, it's still possible to also have COVID happening. So we would continue to monitor them closely, and we can never really take them off the list until they've ceased to be in outbreak.
Anything else for you, Erica?
Yes, sorry. You're saying that you've recommended to assessment centers in the region if they have the capacity to increase testing. So can people now who are having symptoms but maybe don't have close contact or the other conditions try and call and get tested?
I think that's a good question, right? What am I telling the public? Should I be telling the public? They should be asking. I think they certainly are welcome to call and inquire and find out about the individual assessment centers and whether they actually have the capacity to do more testing or whether they have it at this time. So making an inquiry would be a reasonable thing to do.
Alrighty. That's my list. Is anybody on the line who got missed?
Yeah, Dana from Global News.
Hi, Dana. Go ahead, please.
Hi, Dr. Gardner. Sorry,
Hello.
I missed the beginning of this call. I know you probably mentioned it, but is there any additional cases that came in today other than the 108 that are posted online?
So, in fact, we've had some. I don't know how many. They just came in, and so I have no information for you today. I'd be able to speak to that tomorrow.
Right. So just the 108 for now, and then there are some new ones that came in, but the number isn't confirmed yet.
That's right.
Okay. And unfortunately, I also wasn't able to attend the call yesterday, so apologies again if this was said. With regards to the Bradford long-term care home, what condition are the residents there in? How are they doing?
They're doing well, apparently. None have been hospitalized, and that's a very good sign. Apparently, the symptoms so far have been fairly mild.
Okay. And there's 14 residents and 2 staff members, correct?
That is correct.
Okay. Thank you.
You're welcome.
All right. That's just about everybody on the list then.
Lastly, Mike from CTV. Can I just...
Oh, sorry, Mike. Certainly you can.
Thank you. Doctor, good afternoon.
Good afternoon.
What is your main concern right now with what you're hearing, what you're seeing from either businesses or the public? Are we having that issue like we're seeing in other municipalities and the big cities where people are going out and anything that's coming to your attention that you want to warn the public about?
So I would say in Muskoka, a major concern has been people coming from out of the city, the big city, to the north, to their cottages or to cottages they've rented as a way of isolating, and the potential for that to make an excessive draw on their resources, on their shopping, potentially exposing people through that means to the virus, or making an excessive draw on the healthcare system as they become cases and have to be admitted. Earlier on, more than a week ago, I heard some political leaders here expressing concerns about people not getting the message about public gatherings. I know that Barrie has passed a bylaw at this time prohibiting gatherings, prohibiting actually people being within 2 meters of each other except for household members, akin to Toronto's bylaw. So that, I think, speaks to their concern that they need to take that degree of action. I do observe personally very good compliance of shopping centers in setting up their operations to greatly reduce exposure to people, with spacing in lines and one-way aisles and limiting the number on the premises at one time, and having a separate exit from entrance so that people are crossing each other, and having plexiglass barriers between the patrons and the staff. To me, I think that's excellent, marvelous, and proactive on their part. I do see in my own life people on the street making wide swings around each other to keep space, and evidence that there's a lot less visitation in the neighborhood on the weekends, a lot less traffic in cars. I have read in the media that over 95% of Ontarians have taken seriously the message about the seriousness of this pandemic and the need for the physical distancing practices and the measures that the government has taken to close non-essential businesses, schools and other venues, park-related venues and that kind of thing, that there's general public support for that. So to me, I think that there's been a remarkable and very quick progression of action on the part of government that's unprecedented. With, they could not have been easy to do. All the shutting down of those businesses had to be extremely weighty decision on their part to do that. And we see evidence that people are taking it seriously. I'm sure there are still issues that exist. Places that are still problematic for people gathering are not quite getting the message, but I think for the most part, there's been an excellent uptake with the message.
So here's my question. What is your message to those who are saying, hey, this is Easter, Passover, all this stuff. I'm having family over. We're going to have a turkey dinner.
Well, I can sympathize with the sentiment. I would love to do the same. It's been certainly a tradition of our family to do exactly that. And I would say that we, in my household, are not going to do that. There are 3 of us in my household right now, and it will stay that way. We are not going to be having other people over because I don't want to unwittingly infect somebody else. It's possible that I have this right now, and I have no symptoms, but maybe I'm shedding virus, and I wouldn't want to give it to a family member of mine, and I certainly wouldn't want to give it to my parents in their 80s, and so I won't be seeing them until this is over. I'll be talking with them on the phone, and I'll be doing FaceTime with other family members, and I won't be directly having them over or going to their place. I recommend that for everybody else, even though it's very, very difficult and very unpleasant and feels very unnatural. But I think people need to do that to protect themselves and protect each other and help to bring this pandemic to a close. Stay in touch with each other by all means. Use distance technology by all means. Shop for somebody who needs that done for them, but keep your distance as you do it. But I'm recommending very strongly that people don't have that kind of family gathering until we've got this well away under control.
Thank you.
Okay, that's all our questions. I'm going to ask the media to stay on after Dr. Gardner leaves, and we'll give you a quick update on what our plans are for the long weekend. Kathy?
Hi there. So we will be back again tomorrow, but we will not be here on Good Friday. And as you know, we don't do media briefings on the weekend. However, we are going to have one of our epidemiologists come in on Saturday and update that health site with the new numbers so that you at least have that to go on. And I just wanted to also let you know that even though we won't be here on the weekend, our Health Connection line continues to operate 7 days a week, and our infectious diseases team who continues to work 7 days a week as well. So the work continues. and actually Leslie's just reminding me that the infectious diseases and the Health Connection line are for the public. You can connect with us again on Monday. But the numbers will be there for you on Saturday, and we will talk to you tomorrow. Okay?
In North Carolina, you were the first to break my heart. You were the first to break my heart. You were the first to break my heart. My red bone is howling, sniffing raccoons in the forest. Sundays we go hunting. I'll trade them pelts in for a night with you. Pop-Pop smash is cooking. Bessie Ann feeds the goats in the morning. My mama's been saying, if you get lost, follow that smoker back to the still. At the moonshine annual shindig, I'm gonna kiss you while we is dancing. You'll look up at the moon and remember what all of this was for. What was it for? Down on Dixie line, oh Maiden, North Carolina. You were the first to break my heart. You were the first to break my heart. You were the first to break my heart. I got nothing to hold against you. We was only young children then. I got nothing to hold against you. We was only young children then. Way back then. And now we're wading in the water, chasing alligators. My cousin's a snake handler. I'm a real charmer. What you gonna do? I got roots in Appalachia. My family grows tobacco. Pack your pipe and smoke that. Every word I say of it's true. Yeah.
So you've been around this area for quite a while now in the Simcoe, well, predominantly Barrie, I guess, in this area. What does Barrie offer to you, and why haven't you left? Like there's a whole, like you said earlier, there's a whole oyster out there waiting for you.
Yeah.
Is there something here that draws you to stay here, or do you find this like a comfortable nesting place?
It's interesting the way you put that question, what Barrie has to offer me, because quite frankly, it's been nothing in more recent years. It seems that the better I do and the more self-improvement I make, the more I'm ignored by officials in this town.
Okay.
I think, mainly what keeps me here is my mortgage at this point.
Yeah.
And I'm lucky enough to have a home where I can invite, like-minded artists over, and we can practice and hone our skills. And it's really just, people refer to it as a sleeper town. They're commuting to Toronto. It's sort of the exact same thing for me. A lot of my work, getting my stuff out there is outside of Barrie. Unfortunately, it would be nice, but if things were different, but that's just the way the cookie crumbles, I suppose.
That's the truth. So yeah. Nothing wrong with that. Yeah. Getting on to being rooted here, you've also done some international things as well, other than the music. We talked earlier about your movie production and stuff, and the video production. Can you tell us what's going on with that?
I guess most recently is my single "In the Light," which I recorded at Drive, and I put a music video together on literally nothing but the help of two friends and a young child, which is my one friend's daughter. And it was sort of like I had this vision in my head, and we made it happen. And I had intended to send it out there into the world and see what happens. And it was sort of a whirlwind of all at once. After again being rejected from Barrie's Film Festival, I was accepted in London, England. Just a couple days ago, I was informed that it'll be official selection in Muskoka in Virginia.
Nice.
And the video production is, as you know, something I've always been doing. You were a supporting actor in
I
one
was
of
a
my
supporting
films.
actor about 20 years ago. Yeah.
Walking Among the Dead, and things have changed a lot since then.
Oh yeah.
I mean, that was sort of the quickest way you could learn how to not make a movie.
But it was fun.
But it was definitely fun. I think now I just I've reached that certain standard where I won't even proceed unless I know fully, wholeheartedly that I can make this concept the way it is in my head. And if I can't, usually I'll find the means to find a way. But otherwise I'll, alter the idea or move on to the next thing, because I'm not going to, go any lower than that standard I've set for myself.
Yeah, good for you. Good for you. We talked earlier about bands and trying to create some sort of a revenue, and it's obviously it's not as easy as it was 10, 15, 20 years ago, et cetera. But I see that you've taken it by the toll and doing your own silk screening and patches and such. Tell me a little bit more about that. Is that kind of more of a money maker, or is it kind of, well, obviously it is, but to eliminate that middleman and create a little bit of revenue coming in for the band?
Yeah, definitely. It started off as, on paper, here's how much money you can make by doing it yourself, but it quickly became another passion of mine. And, silk screening, it's sort of like it's a classic art form, and it's really relaxing at times when you get past the graphic part of it and you're simply down there squeegeeing ink on the shirt. It's pretty cool. I actually owe a lot to Sean Alton from Fly Graphics for he really helped me on the base level of understanding computer to the practicality of the silk screen, without even being there. Honestly, it was like messages back and forth, and he did some work for me in the beginning to help me out. I think, again, at the CB level of touring musicians, the clubs really aren't paying you, or, it's just difficult getting gas money and things like that. So it just became easy to understand, if we're doing this ourselves, making the shirts, not only am I getting paid, but say like the drummer wanted to contribute and make shirts for an hour, well, he's now getting a percentage off of those shirt sales. And the bass player, if he wanted to contribute, things like that, right? Mm-hmm. And it's sort of like this concept I've had for a while now, and spreading the word to younger bands about like this is how you can do it and make it work. If you're all involved. And for a while, I was providing my space to several artists to come and do their own thing. A lot of it was, I've heard you make shirts now, can you do mine? I'm like, I don't really want to do your shirts, but tell you what, you can come over and do them yourself. Like you can rent my gear kind of thing, rather. And I can show you how to do it. I think that's what is, best case scenario, and empowering other artists to be able to do it themselves, rather than try to take it and do it for them. And do you know what I mean? It's just, I've had like really good people in my life give me tools or help me achieve things that it's better to spread those out there than, keep them vaulted up. Like every man, I dance with the devil, but still in me, I fell in love with her. Like every boy at a young age, I gave my heart away far too early. After all my sins, I will sin again to ensure eternity with that woman. Wasting time with trouble, no other girl would fit my lifestyle except that dark queen baby. Oh, down in the 80s, yeah, she waits for me with a companion like pain. You're easily tempted. Oh yeah. Oh yeah. Loving her is like a disease. All you tightly knitted local folk won't say you're sorry for condemning my bride, burning her at the stake, feeding fuel to my flame and making my bones shake. I'll say another prayer, save us from despair. My beautiful dark angel, will you be home when I get there? Wasting time with trouble, no other girl would fit my lifestyle except that dark queen baby. Oh, down in the 80s, yeah, she waits for me with a companion like pain. You're easily tempted. Oh yeah. Oh yeah. Oh yeah. Oh yeah. Wasting time with trouble. No other girl would fit my lifestyle except that dark queen baby. Oh, down in the 80s, yeah, she waits for me with a companion like pain. You're easily tempted. Oh yeah. Oh yeah. Oh yeah. Oh yeah.
On a more serious note, hopefully you don't mind we talk about this, because we did talk prior and about being in the music industry and being an artist and film, etc., and how drugs and alcohol can be such a heavy weight on us, and we use it as a crutch. I know you've fought battles in the past, but you faced them, and you're starting to make a bit of a turnaround. How do you find dealing with that in the music industry, and what's your biggest challenge with trying to move forward, with trying to keep a straight head in the scene that we're in?
I mean, I think the biggest challenge is that your peers or the people out there in the scenes are also dealing with those demons and may not have made the choice yet to fight against them, to overcome them, and it is an extremely difficult thing, and it's especially difficult when you're in there. You don't realize it's happening, or you don't realize how altered you are. Because I mean, let's face it, we're having fun, and we're out of control, and we wake up the next morning and whatever. A lot of the clubs want to pay you in draft beer, or you have people who have waited to see you out of town, and they have whatever substance waiting for you after, and it's like it can be hard. But I think once you really get to know yourself, and I mean low down, like when you are low down and you look in that mirror and you know that you have nothing left to rely on,
Yeah. Was there a low point that actually where you came to that conclusion?
It was for me in 2015, returning from Los Angeles and realizing I had lived out a lifelong dream of mine, but wasn't really in the moment consciously, because it was just like every other party at the cottage kind of thing.
Yeah.
Like wake up and be drinking and make it to the show, yeah, barely, but you're just not there, and that was a huge turning point for me, because it's just like damn, you know, I was there, but I didn't absorb it fully because, well, how could I, you know? And so then I began to take the steps. My sister Sarah, it was a huge influence on that entire situation. And you know, you remind yourself over and over again, there's at one point for a man, at one point for a woman, you have to, well, I think anyway, that you have to come to that spot where you rely on nothing, no other person, you know, whether it's a relationship, male, female, no drug, no substance, no distraction. You just have to zen out with who you are and move forward with that, you know.
And you're obviously keeping in pretty good physical shape too. Does that help, obviously, as well?
Absolutely. It's sort of, you know, that is the time where I know people have this thing where they just will not alter it for anything, anyone. It's like that hour in the day for me where, you know, I turn my phone off, I won't answer my doorbell, and I'm doing my physical routine, my exercise. It keeps me mentally focused. Honest to God, it's wild how confident you can become mentally, you know, by sweating it out, you know, like in the gym kind of thing. Yeah. I know it sounds like really weird, and it's something that I wouldn't have attested to, you know, 5 years ago. You know, I'd be making fun of the people running at 6 a.m. out there, but you know, I'm one of those people now, and I love it, you know.
Well, thank you very much for being on the show today, Mick. Greatly appreciate it, and good luck on your trip down to the States for your premiere, and hopefully that all goes well, and your new musical ventures.
Thank you, Ian.
You're very welcome. Take care.
At Kawartha Dairy, it's been 80 years of fresh, delicious dairy products and 80 years of incredible memories. We've come a long way since 1937, and it's all thanks to our amazing customers. Thank you, Ontario. Here's to 80 more years.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV.
Through United Way, I did a self-esteem course, training for peer support, and now I volunteer. It's a lesson that comes from the nature of doing work with the United Way that gives me a new lease on my life.